Well, throughout the pandemic, health officials have warned that COVID could be more severe for people with additional medical issues. A new CDC report now brings obesity into that mix, something that really comes as no surprise to doctors here. Our Mariah Gallegos reports.
Living in South Texas, we do have higher obesity rates in South Texas.
Higher obesity rates and higher diabetes rates, both risk factors for severe COVID-19 cases.
Because your body is already stressed with all that extra weight, then, their body doesn't really fight off the infection as well.
Dr. Kim Onufrak with the City County Health District says this report from the CDC didn't surprise her.
It's something that we've seen, and it's something that we know. I just don't think the general population knew it, but medical professionals, we knew that obesity was a risk factor.
The report shows over 50% of national COVID-19 hospitalization patients were obese or overweight. Onufrak says the battle against COVID-19 continues, and until we get down to 0 hospitalizations and 0 deaths, everyone should continue to take care of their health.
Our deaths have started to trend down, but we still, we had 3 deaths yesterday, so it's not gone away yet, especially in this area.
Mariah Gallegos, 3 News.